Today, I want to share a COVID related story. Hello, I'm Dr. Brian McDonough. It's not a dramatic story by any means, but it illustrates the importance of wearing masks and social distancing, at least from the standpoint of physicians who are in practice who deal with this every day. I'm chairman of a family medicine department, and as part of my role, there is a residency program where we train young doctors. And part of training for young doctors includes going to big conferences and discussing health issues as part of the learning experience. COVID, of course, has taken this world and really turned it on its side like everyone else. And most conferences are now done by WebEx. But as some of the rules have been more or less relaxed, we realized that we can do WebEx. And also, we have a huge auditorium in the hospital where I work, where we were able to get a number of the physicians who can be really 10 feet apart in chairs, wearing masks in an indoor, well ventilated setting, listening to lectures. So there was a lecture going on the other day, and I arrived late. I walked in, and as in my role, I wanted to be there. I came close to the front for an available seat, made sure I was socially distanced from everyone else wearing my mask, and I sat down. The speaker immediately stopped, who was in front of me, and said, "Please, can you move somewhere else?" Now I did, and I kind of thought, boy, you come in a little late, they're going to yell at you, but I just kind of went to the back. Later on, I asked the speaker, "Hey, did I do something wrong? What did I do?" And the speaker said, "No, I was speaking without a mask, and you were about 12 feet from me, and I was concerned that even though you were wearing a mask, there may be particles that could hit you." Now, why do I tell this ridiculously long story? Because it makes a point. You have a group of physicians who do nothing in their life but treat patients, and basically one thing we're good at is learning science and evidence. And you have a physician who's a speaker who is so concerned about the potential of any aerosolized droplets to hit me, even though I was wearing a mask, that he asked me to move. Now, did I have to move? Probably nothing would have happened. But the point is this. When you hear people talking about the fact we don't need masks, and it's not a necessary thing, or masks don't provide protection, or when you hear some physicians saying there's no evidence to support masks, physicians in high positions are saying that sometimes. Think about what the doctors on the front lines are doing. Think about yourself and your family. The doctors on the front lines are wearing masks and social distancing. Do you think they know? Do you think they're worried about protecting themselves? I mean, it's what they do all day? Or do you think they're just trying to put on a show in front of people who are other doctors? I tend to think they're trying to protect themselves and others. The reason I say this is I'm going to add one more thing. I don't do many of these videos anymore because there really isn't a lot to add, and I'm not going to waste people's time. But every now and then it's important. And what I'm going to do is tell you something that I think is important for me. Who knows where these videos go? Who knows who sees them? Who knows if they're ever watched? I mean, they could be, they couldn't be. But if I'm going to go down in some minor form in history, in some sort of recollection of me standing for something as a physician, I'm going to tell you that I have had very few dramatic statements in my career. I tell people not to smoke. I tell people that exercise is good for them. I tell people that they should get preventive screening to make sure they protect themselves. And I'm going to tell people to wear masks. Now think about it. I'm not telling subtle things. I'm telling overall obvious things. Things that make so much sense that it's almost absurd to ignore them. Not smoking, wearing a mask, exercising are all things we know that can help you. Now, you may choose not to do it, but understand the risks when you choose not to. That's my job. My job is only to tell you what can help you. So when you hear people talking about not wearing masks, and you hear people talking about it not being important, listen to me. If you love your family and you love yourself, wear a mask or at least know the choice that you made.